Well, new numbers show some veterans in Maryland are still waiting more than 2 months for a doctor's appointment. An audit released today shows the average wait for new patients trying to get a primary care appointment is around 74 days. It's down from the roughly 85 days that veterans were waiting several months ago. Since those original numbers first came out, the VA kicked off an aggressive action plan. Today, another step in the plan to cut down the waits for the veterans who gave so much for our country. It's a backlog we've all heard about, but for Dr. Peter Bielenson, when an audit from the VA showed our veterans were waiting on average around 81 days for an appointment, he stepped in.
These are people who have not been able to get in for their initial visits for a significant period of time.
Dr. Bielenson started Evergreen Health back in 2010. Now the nonprofit is partnering with the Maryland VA healthcare system to cut down on wait times.
The health care at the Veterans Administration is really quite good. The problem has been that they've been stuck with not having enough capacity to serve patients.
Thursday, the VA announced a one-year, nearly $500,000 contract with Evergreen. It'll give veterans on the wait list the option to go through Evergreen Health or remain waiting for the VA.
We're very honored to serve those who have served us. Many of these veterans have been without care for 90 days or much longer, and so we're very pleased to be able to offer these services.
The option mostly affects veterans new to the system, the same veterans who are waiting nearly 3 months for an appointment when the audit first came out. Right now, the average wait time for new patients seeking primary care is right around 78 days. How will your wait times compare?
They will be considerably shorter, generally within a day or two, but certainly within the week.
An option to be seen within just a few days. It's all a part of the VA's aggressive action plan that they kicked off earlier this summer. Another step toward better helping the veterans who served our country.
I think they're pleased, and they're very, most importantly, because the veterans that they're charged to serve will now get very substantial, robust primary care services and health and wellness and substance abuse and mental health services in a timely fashion.
We've done a handful of veteran stories right here on In Focus. The VA commonly tells us they cannot comment on specific cases, denying us an on-camera interview. We've reached out to the VA to talk to them about this positive partnership, and they still told us they were not commenting on camera. Instead, they gave me a statement saying, in part, this partnership is a major component of our aggressive action plan to improve patient access and demonstrates our commitment to delivering safe, quality, and compassionate care to Maryland's veterans. The VA emailed me saying Dr. Robinson was no longer available for interviews. In May, Dr. Robinson told us right here on In Focus that problems in other cities were not an issue here in Maryland. He told us veterans can be seen in 2 weeks if it is not an urgent care. You can find the VA's full statement and more on this story on our website. That's at abc2news.com/infocus.